832 new cases diagnosed of COVID-19 here in British Columbia. And again, yesterday we went over that precipice of 100,000 cases, and we now have 100,880 people in British Columbia who have been diagnosed with COVID-19. Today, 310 were in the Vancouver Coastal Health Region, 388 people were in the Fraser Health Region, 53 people were in Vancouver Island Health, 42 people in Interior Health, and 39 in the Northern Health Region. We currently have 296 people in hospital with COVID-19, 79 of whom are in critical care or ICU. We've had an additional 5 deaths to report today, bringing the total number of people who've died from COVID-19 to 1,463 here in British Columbia. And our condolences go to the families and care providers and the communities who've lost their members. To date, we've had over 787,649 doses of all 3 COVID-19 vaccines that we've had available administered in BC, and 87,394 second doses. More of the details on things like variants of concern and the outbreak status will be in the statement when it's later this afternoon.
详细的信息呢，他说会有书面的给大家 statement， 但是我知道很多人有很多的问题，对这个新冠的有一个一波高潮，包括疫苗。那么我今天会对这个疫苗更多的描述一下。那么3个已经在批准，加拿大批准了，大家都有点模糊。那么相互之间的疫苗之间的区别，大家都不是很清楚。有先批准的是莫德纳和辉瑞。那么这2个是我们构成了 BC 省的基础。
Since
就是 mRNA 技术，就是信使蛋白技术，这个是构成了我们 BC 省今年抗击新冠疫情的主要的防线疫苗防线。那么我们还有牛津的这个阿斯利康疫苗。那么还有一个强生公司的强生和强生的这个和那个牛津是相似的。那么强生的只要打1针就可以了。所以其他的除了强生以外，其他的3个都是要2针。第一个针叫Prime， 第2针呢叫 Booster。那么那个强生呢，只要1针就可以了。能够使身体里边的抗疫机制免疫机制就能够激发起来。那么大家全世界呢都是在紧密合作，科学界都在紧密切观察这些疫苗的有效性和已经发觉这个又安全又有效对这个新冠病毒抗击很有效，而且很安全。
With as short a period of time in between doses as possible, so that we could get as much information and get the vaccines out there as quickly as possible.
因为疫苗在面世呢很短时间，那么我们都在积极的收集数据研究。那么所以呢，现在看来，只要打1针的话，身体里边的抗体激素水平就会很高。所以会很效率会很高。那么第2针的话呢，会使身体那个已经是从80%以上有效性更加好。那么同时呢，我们也会发觉这些都会很有效，那么使得对这个重症的发展包括这个住院以及抗击死亡都很有效，很有效。包括了这些没有这个防止人的这个中期的或者是轻微的症状发展到重症状。那么现在呢，英国还有很多，以色列包括加拿大包括魁北克省BC 省都有这个强烈的跟踪这些单1针阿斯利康疫苗都会有80%以上的有效率。
So these are important things
所以这个是大家
we have learned.
很清楚，这个是我们
I've
大
been
家都
asked
知
a
道的
lot
结论。
about how the body mounts its protection against
各位
the
观众，因为
virus.
今天它开始的比较
And if
突
I'm
然，
vaccinated,
所以呢
why do
我
I
就
still have
只
to
顾
wear a
记下来了，
mask?
没有给大
It
家
takes
说。
time for our body's
昨天
immune
到今
system
天
to
新增的
respond
是
to the vaccines, no matter
832
which
例，
vaccine
那
it
么
is.
他说昨天
And it
开始
develops
就超过了
two types of
累计超过
immunity.
10万了
The，first
今
is
天的
one
累
that
计
we
数字
can
就是
measure in
10
the
万
blood, and this
8000
is
多
called our
啊。
antibodies. And we've seen a lot of both antibodies recently because they're one of the markers that helps us understand if
那
we're
么今天
if
他
we
主要是
have
讲
those
了疫苗，
protective
他只解
mechanisms
释一
against
下
the virus.
疫苗
These
这个
antibodies
区别
bind
以
to
及疫苗的
the
有效性。
spike protein on the outside of the virus.
这个
And
是
all of
讲
the
解释一
vaccines
下
that we
这个
have
疫
so
苗
far
的作
are
用。
designed to
有
develop
些呢
for
我
your
不一定
body's
完全
immune
听得
system
懂，
to
他也
develop
是就说
antibodies
如
to
何
the
记
spike protein.
信使蛋白疫
What we
苗
don't
以及
know
那个腺
is
体
what
疫
level
苗
of
的区别，以
antibodies
及
we
如何
need
机
in our
体
blood
身
to
体里
protect
边
us from
抗体
infection
的水
or
平。
from a disease with this virus.
所以他说，不管怎么样，
That's
这
what we
些
call a
疫苗
correlate
都有
of
效的
protection.
防止
So if
人
antibody
从这个
levels
轻
don't
症
get
发
as
展到
high in
重
some
症，
people, and we
特
saw a
别是
study,
从重症到死
including
亡
some，
这个
from
保护
here
是
in
很高很
BC,
高的。那么
where
第一针呢，
antibodies
他
in
说
people
都
who are
会
older,
79%、
or people
79%
who
到
have
80%
certain
以上
blood
的有效
cancers
率。
or certain types of immune-compromising
那么很
conditions.
多人，有
Those
些人如
levels
果
may
他们
not rise as high as they
那
do
么
in
有些如
younger,
果有癌
healthier
症的，
people.
或者是免疫系
But
统
what we
本身
don't
有
know
问题的
if
话呢
that，
打了
has
疫苗
any
之后呢，
effect
身体里边的
on how well
抗体的
the
水平、
virus
激发水
or the
平
vaccine
不如
protects
平常
you
人
from
的
the
这个
virus
抗体
in
水
the first
平
place.
啊。
What we have seen from
那么
the
同时呢，我们也
vaccine
会发
effectiveness
觉
studies that we have
我们
is
根据
that
更多研究
regardless
这个
of
有效性研
antibody
究
levels,
那么
there's a
抗体
very
的
high
身体水
protection
平、
in
抗体水
seniors
平
in long-term
特别
care
是对
that
在
lasts
这个
for
长
many months,
长期
in
护理
healthcare
院、老年
workers,
人里
and
边
we're continuing
特别有
to
效，
monitor
而且
this
会
on an
持续
ongoing
很
basis.
长的月份。所以我们还会持续的观测这些老年人身体里边的抗体水平。同时呢，我们也知道人体里边的免疫系统会被激发起来，特别是激起的 B 细胞等等不是所以这样的话呢，是因为疫苗打下去呢，至少要1星期到2星期才能使人体的抗体能够彻底激发起来。
Is that the protection is very good.
所以他说保护率是很高的不是说一般好是很好，但是呢，这个是需要时间使身体里边的抗体能够激发起来。
For about 21 days after
一般是21天3周。
Protection may not get as high.
对对，有死亡，新增5例死亡因为我就有一个就是296个人住院，76个在重症监护，也是慢慢下来了。昨天是比较吓人，只有1000人以上的新增，但是呢，他们呢一般呢不看当天的，因为你时间收集的时间这个 deadline 多1个小时少1个小时，那么数据就会差很多。一般呢。他们会看7天的平均数，那么的确从3月下旬以来到现在，7天的平均数真的是很高。但是好消息是，自从3月中旬以来，我们已经看到好几天，包括他们新闻简报，包括发的书面通知，都有0死亡的这个记录，已经有好多4、5天了这个也是一个好消息。
I've often been asked if I've had I get many questions about if I've had a reaction to another vaccine, particularly the influenza vaccine.
那么他说很多人也问我已经打了流感疫苗，那么这个有相互影响吗？他说没有问题的，疫苗和疫苗之间没有关系的。
And they tend to have very few ingredients in them. What we do know is that the messenger RNA vaccines
因为这个我们的新冠疫苗现在是信使蛋白疫苗，这个原理是不一样的，它是模拟这个人体的这个不是很懂这个人体的这个细胞，然后激发起人体细胞的抗体。
So if you know you have an allergy to PEG, and some people do, then you should be looking for the AstraZeneca or the Johnson & Johnson vaccines. Otherwise,
所以大多数人都会对这个信使蛋白疫苗是没有问题的。但如果是有这些问题的，可以选择打阿斯利康以及强生疫苗。那么现在事实证明呢，mRNA 信使疫苗蛋白是很安全的。今天早上我看到一条消息，我们温哥华港湾网站发的一个消息说，阿斯利康到了 BC 省也是被秒光，也就是一会儿就打光了。
is most often triggered by the infection itself and could be triggered by COVID as well. And it's very less likely, much less likely to have anything to do with the vaccine. Along with the vaccine programs, I get asked a lot, and I know there's been a lot of questions out there about the interval between our first and second doses for the three vaccines that we have right now. And as you know, in BC and in Canada, our strategy is to vaccinate as many people as possible, for the greater benefit of everyone.
那么这样的话呢，能够建立起第一步的防线。所以呢，
started to see our cases take off again.
我们现在已经看到了这个数字新增又在增长take off 现在要飞机起飞叫 take off。那么很多人现在面临着这个感染的问题我们不希望看到的就是要住院以及击垮我们的医疗资源。所以我们的目的就是想让更多的人先打第一针打起来那么这样的话呢特别是那些高风险的必须上班的基础工作的人让他们先打，然后呢我们再考虑给更多的人打第二针。我们的一个专门的有一个科学家专家叫 Nancy， 他们会监测这个第一针打完之后人体的反应抗体水平等等所以我们都会紧密的观测现在呢 NBC 报下来，现在有人体高水平的抗体第一针打完4个月，目前为止，因为现在莫德纳也好，辉瑞也好，目前也就4个月为止，所以现在呢，到目前为止还抗体水平很高。那么现在呢，我昨天也是收到了政府的邮件说，从今天开始对73岁以上老人开放打疫苗了。这个也是远远比之前所预定的时间表快很多。Extending that interval actually has some benefits to people, and we've seen that with other vaccines. 所以他也是说到了疫苗给人类带来的更多的好处、益处我们都看见了，都能够体会到。所以呢，但是呢，这个还是要给打完了疫苗，不是万事大吉，至少要3星期、21天以后，人体里边的抗体才能够被完全的激发出来。那么他说有79到80以上的。80%以上的有效率。
We also don't know how well these vaccines will continue to work as
但是我们现在还不知道那个这些疫苗对今后的各种各样的变异病毒的有效率是怎么样但是呢我们也是在紧密的观测所以这样的话呢但是始终让我们知道这个疫苗使得能够让人体避免重症发展成重症以及死亡，这个是很有效的。所以他说我们也是
people who are older may not have as good protection even after
有些是白血病的人还有年老人他们本身的身体的这个抗体有问题，那么这样的话呢辉瑞以及这个信使蛋白疫苗呢可能作用就有限，这样的话呢就要打这个强生以及阿斯利康。我们阿斯利康疫苗新闻里边经常看到 AZ 疫苗就叫阿斯利康疫苗。
One of the other questions
那么他也是说到了以色列和英国是一个很好的一个榜样，他们那边的新增数字是急剧下降，他们打的就是阿斯利康疫苗。
And how come we're not immunizing the family caregivers as well, whether that's somebody who's caring for a child who can't be immunized,
那么现在呢，还有一个 caregiver 呢，就是照顾别人的人，你家庭照顾老人啊，照顾小孩啊，就叫 caregiver.
And protecting people directly, unlike many other vaccines. So we know it works well in elderly people, for example. So our priority is to get vaccine as it arrives into those people who are most at risk first.
所以我们的优先次序呢，现在还是给那些先高风险的人先去打，先给年长的人打，然后再给普通的人打。这个也是始终强调的疫苗的策略。
But when you're visiting an individual, your loved one or friend in a long-term care home,
那么如果你们有亲戚朋友呢，都是在长期护理院的如果你是要经常去看的如果你是觉得有这个保护他们的，你有这个暴露病毒的这个可能给他们带来风险的，那么这个呢要采取措施，所以呢这个就是要。去联系我们就要去打
of every vulnerable person with the vaccines that we have available right now. So we need to do this on a risk-based process.
所以我们现在是根据风险决策来看。一个是年龄，第二个就是根据风险来了。也就是说，年龄以外还有多的话呢，先给有风险的人先去打了。比如说我50岁，他40岁，但是他的风险高，那么让他先去打了，是这个意思。年长的先保护起来，长期护理院以及这个长者等等，80岁、70岁的都让他们先打。
Which is the Serum Institute of India, the AstraZeneca vaccines for those under the age of 55. And how that may impact
那么阿斯利康疫苗呢，就是说现在55岁以下呢，因为可能考虑到这个对他们身体的潜在的，现在还没有那么现在呢已经开始决定暂停怕有一个血栓的风险特别是在这个那个脑部的血栓等等那么这个风险呢是100万里边有可能一个，其实1 in million 其实很少很少了那么他说英国欧洲就是没有几例29例，也就是几千万里边才29例。那么现在呢，加拿大以及这个 NACI 是一个这个疫苗的这个委员会都是在紧密的看详细的去观测这些阿斯利康得给人体带来的副作用，到底风险和利益谁轻谁重这个是在加拿大。那目前为止，所以55岁以下暂时先不打。那么全球来讲，也这个血栓也就是几个several dozen 是12个 ，several dozen 就是几个12个。那么所以呢。
The AstraZeneca Covishield vaccine clearly has benefits.
那么对55岁以上的人来讲，这个阿斯利康的效力，这个好处是很明显的这个是看得见的，对每一个个人对他们的这个这个身体里边的抗体这个机制有效的记出来。那么对年轻的人上，我们一定要搞清楚，确保。对年纪轻的人来讲没有引起血栓我们一定要看清楚这个阿斯利康对这些年轻人55岁以下的人对他们造成的风险大还是那个利益大好处大，所以我们这个在加拿大还要做一个评估。那么我们在英国欧洲的科学家们都是在紧密的积极的观测研究这些。
Millions of people with new vaccines.
我们现在已经用这个新的疫苗保护了几千万人的生命了。
When we see something
如果我们看到一些不好的现象，这个不正常的现象，那我们就会很小心翼翼的。所以我们一定要确保每一个疫苗又安全又有效。那么一定要20天一定要超过20天。这个是今天又说了一下，不是2个礼拜，上次说过2个礼拜以后的有效率是50%以上的。那么现在呢是21天，3个礼拜以后都是79到80以上，第一针就这么高了。
But I am very confident that we will get to
所
the
以他
bottom
说
of
我
this,
相当
and
自
this is
信
still
的
an important
这个
vaccine
也
for
是
our
这个
programs
是
here
我们
in
的底线
Canada
了，也就
and
是说
around the world.
辉瑞啊。莫德纳其实对大多数人来讲已经很有效果了，因为它的作用就是信使蛋白根据这个原理，那么有些人是没有用，为什么？它本身就没有免疫系统特别是那些白血病的人其他癌症的人还有免疫系统本身有问题的人那么他们辉瑞莫德纳打了没有用，因为这个他们本身就没有免疫了你再去揭发也揭发不出来，所以呢，这个的时候呢，要有打那个阿斯利康以及强生，这个是今天给大家公告的一个信息。那么他也是说到了，在英国已经几千万支阿斯利康用完了用过了他们也打了辉瑞相互之间混打，有第一针打了这个，但是上次说过了是只要是同一个技术的，比如说辉瑞和他说不同一个技术都可以，你看到吗？阿斯利康第一针，辉瑞第二针，有些人是辉瑞第一针，阿斯利康第二针都可以了。原来是说过同一个技术，不同的品牌可以混打，现在是不同的品牌、不同的技术都可以混打所以他也是说这个科学家都是给出了很有效的建议。好在呢，加拿大是步英国后，英国呢和以色列是走在最前面，所以他们有什么问题，我们加拿大就会慢慢跟进，这有好处也有坏处。所以现在目前为止，这个他说这个疫苗是远远超过预期的好，而且是有效。那么那么下星期呢，我们的工作人员呢都会收到更多的阿斯利康疫苗那么因为现在55岁以下都暂停打这个阿斯利康，那么我们还要给这个第一线工作人员要打，我们所以要重新的编组接下来的礼拜呢，我们会安排这些信息，他们会有更多的收到我们通知。那么我们现在呢，很多人问哪些是决定这个人是有要打的，就是英文叫 vulnerable， 就是易受攻击的，就是这些人可以先打的，哪些人先打，这个是要如何决定这个是他说这个呢也是根据这个全球流行的一个判断数据来指导我们科学家来预估比如说这个给家庭医生包括儿科医生都让他们来评估哪些做一个指导方案，哪些人是认为这个 vulnerable 的，让他们先打。
based on data and evidence
所以这些呢都是根据全世界的科学数据来做出这个分析，所以请大家还会要耐心一点。那如果你是符合的这个条件的这一部分人，都会有收到来信通知你去打疫苗。
And people who are concerned that they're not on this list, we need your support to stick with these categories as they have been developed. Everyone will get vaccines
所以大家千万不要急，在接下来的几个月里边，每个人都能打得到。无非呢，就是先让这部分人先打。我知道大家有很多的问题，包括强生疫苗
And the answer, unfortunately, is we don't yet know. We are hearing that there will be a shipment that we are may receive by the end of April.
那么我们现在还不知道强生疫苗会什么时候到多少，但我们知道马上就要运货来，又会这个也是好消息，我们会给大家知道什么时候到货。 这个因为只要是1针就可以这个给大家更多的灵活性。
The other one that we know is on the horizon that may get approval in the next few weeks.
那么接下来还有一个新Novavax 也会要来了这个也是刚刚浮出水面，可能接下来几个礼拜以后又会批准。这个也是对我们来讲是很有帮助的。我们也会做计划那么会这样的话，现在有5个了接下来马上就会5个我们马上就要加快我们的全民疫苗计划了。
So if you have any other questions about our vaccine program,
所以大家如果有疫苗的计划的问题，请大家还是访问我们的 BC CDC 的网站那边有很详细的信息，大家都可以找到你们需要的信息。那么现在大家就知道了，就强生马上要到了，那么 Novavax 呢过几个礼拜也会批准的时候也会来那么接下来又是一个长周末，明天开始这个耶稣受难日英文叫 Good Friday， 礼拜一呢叫这个 Easter Monday 这个那么 Easter Monday 呢不是国定节假日但是呢很多的学校是放假的这个政府机构是放假的但是它不是国定节假日，明天是国定节假日 Good Friday。 那么我们的首席医官 Bonnie Henry 呢也是再次语重心长的告诫大家长周末了别放松警惕，别什么都别那么尽量都是在室外所以大家也要采取措施防护保护也谢谢 Helen 谢谢你的鼓励。
That means ensuring you're giving enough space to others.
所以也给大家也是要给足够的空间看到人群远离一点那么人群呢少一点如果你不舒服呢就远离人群待在家里那么现在我再说一下旅行的问题，大家因为长周末了现在不是旅行的时候这个不是的不是没有什么给你悠闲的去旅游去度假，这个现在的风险还很高。我们如果外出的话，我们回来就把别人的风险带过来带给别人了，其他地方的风险就带过来了所以这个礼拜请大家不要走好吗？就待在家里。我看我们华人绝对做得到这些应该给他们那些老外多说说。
If you need a break, go to a local campground. Stay in a local hotel.
那么如果你还是想放松的话呢，就是待在本地的这个去公园走走旅馆住这个也还有一点很重要的就是我们堂吃是禁止到4月17号，所以这个也要请记住。但是有一点所谓的堂吃呢不包括 patio 呢就是晒台阳台的这个 dining 是可以的。
We know that families have been waiting for this for a long time.
我也知道，他说老年人呢，都是很长，大家都是在讨论这个问题，什么时候可以去探访老人这个一定大家一定要引起重视，因为现在我们全省的风险还很大。
And we don't want that now.
我们不希望看到疫情反复老年人的这个防线是开始建立起来的我们希望大家还是能够安全的去做任何事情那么你就去看自己所最亲密的人就可以了，不要再去看其他的人了。如果你不舒服的话就待在家里那么这个长周末呢，我们希望大家还是安全让我们共同正确面对这次全球流行病那么大家也知道越来越多的疫苗会来，那么请大家耐心。同时呢，大家看到病毒还在快速的传播，所以希望大家能够待在室外就待在室外，能够在本地就在本地，那么能够这个在室外就室外那么也能够共同努力拉低曲线希望大家能够有一个愉快的 安全的长周末，请大家还是记住be kind, be kind, be calm, be kind, be safe。这个是他著名的。
Thank you very much, Dr. Henry.
那卫生厅长，那么他也是说了，过去对24小时死亡5个人的亲属表示诚挚的哀悼。
From COVID-19 or related to COVID-19 in the last
或者是死于直接的、间接的死于新冠病毒的因为海外的统计都是这么统计的，就是跟新冠相关的死亡，不是直接死亡那么如果是直接死亡的话，这个数字会很低很低美国的 CDC 统计了一下，如果是直接死于新冠的，估计就1-2万，而现在的数字是50几万。当然按照这个直接死于新冠的，也就是中国的统计方法我们这里边不牵涉到政治，但我们也是要说事实，也就是说现在外面因为新闻嘛，就是越快死了多少人，死了多少人，但是科学的严谨的角度来讲，是新冠相关死亡多少人这个完全跟不说了这个我们不说意识形态的问题，这个但是请大家要有明白不能说这个新冠带给人多少死亡了不能这么说。当然我们可以说没有这个新冠这些人不死所以这个西方的统计是对的，也就是说死于新冠相关的死亡不是某些国家这些都不算，直接死于新冠的是这么算的，不一样了
I want to, like Dr. Henry, talk about a few issues that
那么我把过去24小时的数字再给大家汇报一下，因为我一开始打开的时候呢，我没有给大家打招呼，我就记数字了。在过去24小时里边新增了842例，那么总数呢到了108000多，8800可能是，我没有完全记下来。但是有一个现象，就是沿岸卫生局是310例，飞沙卫生局388例，这个是跟过去完全不一样。原来呢都是飞沙卫生局是一骑绝尘都是其他的都是2倍以上的，但是现在呢沿岸都有310个，飞沙卫生局388个岛上是53个，内陆是42个，北部是39个，住院呢296个下来了，的确是下来了，感谢主恢复到3月中旬的水平了。重症监护呢是76个，新增的死亡呢是5例。
COVID-19 program that is using Pfizer and Moderna. I want to say that it's supply, though. It's 1 in 6. And what has been exceptional in our immunization program led by Dr. Penny Vallon has been exceptional at delivering vaccine as it arrives in BC.
有一位网友留了一段话，今天有一个从去年下半年从武汉实验室好像是香港实验室逃出来的一个严丽梦女士，是一个女科学家、病毒学家，她针对世界卫生组织发布的那个溯源报告提出了科学方面的质疑。这个我们科学归科学，政治归政治他们科学家可以提出他的质疑，那我们吃瓜群众没有办法看到这个，也没办法看懂，那只能说应该有人提出质疑。那么如果你这个结论，世卫组织的结论是正确的，是经得起挑战的，就像我们圣经一样，几千年来经过那么多人的挑战，它永远还是那本圣经。那你世界卫生组织做出的这个结论，你经得起各种各样的挑战，那你就放在那儿。如果经不起挑战的，你允许人家来质疑这个是我个人的看法，我不抱任何政治观点。
Have been for priority, for vulnerability, for saving lives with vaccine in BC have been the priorities, and we are in fact ahead of schedule. I told you from this podium that we expected approximately 10%
那么他是卫生厅长，他不是我们的首席医官，所以呢，他说话呢更有点是像政客的一个说法。但是他的这个政客呢和因为是因为加拿大的政府，他的政府的权力没有那么大，所以他也是只能给 观众也是一些民众只能语重心长就是说不能命令不能你们该怎么样怎么样，该怎么样怎么样没有这种以上到下的这种指示这个也是国情不一样。那么他现在又是说到疫苗收获的情况以及施打的情况。
We received 34,000 doses of Moderna. We were expecting to
也是
receive
说到
the
上个
remaining
礼拜收到了34000个针的这个莫德纳辉瑞是78000的
all of that vaccine to arrive.
所有的该计划的疫苗都该到的都到。
If you look at next week,
那么下个礼拜的话呢
？We were expecting 138,060 doses of Pfizer
10万针10万剂的疫苗会总共会包括了这个辉瑞和莫德纳。我认识的周围的朋友的长者、老年人都开始打了，都打完了，是非沙卫生局下的打的最多的还是辉瑞和莫德纳。那么他也感谢这个那些工作团队做出的工作努力。
And so on Monday, that change and that with respect to people under 55 was announced. By Tuesday, we'd organized, working with the BC Pharmacy Association.
那么礼拜一做出了暂停55岁以下人施打阿斯利康疫苗的决定。礼拜二，他们这个团队开始就是重新调整疫苗施打计划所以重新就是快速反应。
Doses have been distributed now to pharmacies across Metro Vancouver, and that is happening now.
那么现在呢，又会部署到各个药房。那么他也是说到了，就是他们如何快速的部署反应现在要把这些疫苗都部署到大温地区的各个药房。那么这样的话呢，大家就会可以去打了。
198,561 people between the ages of 55 and 59.
那么，因为在大温地区，55岁到59岁的都现在能够是打的是有18000人，那么现在都给他们打了。那么我们现在呢，所有的这些该发出去的疫苗都发出去了，都让他们打了阿斯利康。
That's a further 188,800 doses, and more is expected next week. And over the next few days, Dr. Ballum and her team will be informing people of how that will be distributed. So, and we'll see a significant portion of that going in to our effort with the BC Pharmacy Association. I think all of that is good news. But
所以这个也要联合 BC 省的药剂师学会跟他们一起合作，然后呢，这个疫苗的发放给他们，让他们药剂师可以打。那么这样的话呢，我们就不要集中起来去排队打，因为我2个星期前的礼拜天，在树里的 Central City， 我看到原来的 Best Buy 那个地址，很多人排队进去打。我说很多人可能也就是10几个人在排队在室外室内还没有看到。
Dr. Henry talked briefly about long-term care. I'll be one of those people visiting a loved one in long-term care this week.
那么现在又说到了长期护理院的探访工作现在还是要大家小心还要小心，不能掉以轻心。特别是这个长周末了，大家就像我们一样的到了周末了去探亲啦、访友了。现在呢，又是长周末要到了，也是到了这个探亲探望老年人的时候了。希望大家能够遵守我们的卫生行为规范能够小心翼翼、仔细认真能够。
Thinking or close or feels they might be ill, not to visit a care home this weekend, even though it's been, I know, for many people a year's wait. We have to be prudent and care about infection control right now. It is very important that residents of long-term care get visits. It's also very important that all of us stay safe. I want to just note very briefly today that health authorities report that in the week of March 15th to 21st, 6,894 surgeries were completed in British Columbia. And that is, of course, significantly more than last year. As you recall, last year at this time, the non-urgent scheduled surgeries or elective surgeries were postponed in British Columbia, so obviously that comparison doesn't work anymore. I just wanted to break that out by health authority. That's 1,993 in Fraser Health, 1,145 in Interior Health, 364 in Northern Health, 1,663 in Vancouver Coastal Health, 1,450 in Vancouver Island Health, and 279 in the Provincial Health Services Authority. I just want to say there is usually somewhat of a slowdown, which was less this year than in most years around March break, but I want to thank all of our teams, people, our anesthesiologists, our whole teams, our surgeons, our surgical nurses, our healthcare workers, our health sciences professionals, everyone involved in our surgery program, which continues to meet and exceed all expectations in this very, very difficult time to operate in BC. Finally, I just wanted to note that our online platform for the booking of immunizations will go live on April the 6th.
那么4月6号以后呢，网上预约都可以开始了。目前为止，只有菲沙卫生局是网上预约的，其他的卫生局还没有。那么现在呢，他说4月6号以后都可以了。大家如果不能上网的或者不喜欢网上预约的，都这个我们的电话中心还可以的，还可以用的。那么现在呢是4月6号现在都可以通过网上来预约。
For your age cohort to book, you will be sent a text or informed, and then you book your appointment. So it's registered, invitation, book. That's RIB, right? That's RIB. Okay. That's coming up April 6th, and I think it also will be a legacy to the province in terms of how we can track immunizations from a public health perspective, but also how people can get access to the information about their own immunizations.
今天2位语重心长啊，特别是 Bonnie Henry 讲了比较多一点，也是解释了一下疫苗。
Today, we're going into the Easter weekend. It's typically, although not as much the last 2 years, my favorite holiday weekends of the year for all kinds of reasons, personal and otherwise. But this weekend, it's not about the person we saw going the wrong way down an aisle at a grocery store. It's not about the group we saw in the park that looked larger than 10. It's not about the person who seemed closer to us than 6 feet or the person whose mask wasn't on right. It's not about the mistakes any of us has made. Today is not about what we didn't do, failed to do, or should have done. Today isn't about our ideas about who led the spread. Today is about how we unite in the fight to stop the spread. Today is about what we can do, what we must do, and what we will do to stop the spread. Today is about where we are, about who we are, and about where we need to be. Today, 16.3% of the 4.3 million eligible British Columbians have had their first dose of our available vaccine. That's encouraging, but it's nowhere near enough. So today is the day in our hearts, our words, and our actions, especially our actions, when we commit to the simple truth. It's us and the vaccines against COVID-19. Our focus right now must be tight on what we need to do today and tomorrow and right through this Easter weekend to stop the spread. Let's focus on the immediate work at hand, and let's keep moving forward together, because we're all better when we're working together. We know how to dig in, we know how to dig deep, and we can get ourselves out of a tight COVID hold. So let's bend a new curve, not the old rules. It's us and the vaccines against COVID-19.
是新的曲线。原来呢，3个星期前有记者就问保尼说，现在这个新增的数字大了，是不是可以形容为第3波？那么当初的时候，我记得很清楚，保尼就说，犹豫了下，他说第3波好像还不像啊，我们不能简单的称为第3波，但我认为媒体现在就称为第3波啊，这个不管是他们统计学或者流行病学是怎么去定义、怎么去看这个问题，对我们外行人来讲，这个就是第3波。
Parmi l'ensemble des cas confirmés de COVID-19, 296 personnes sont actuellement hospitalisées, dont 79 en soins intensifs. Merci beaucoup. Thank you very much. We're happy to take your questions.
As a reminder to reporters on the phone, please press *1 to enter the queue. You will be limited to one question and one follow-up. Please also remember to take your phone off mute. You will not be audible until your name is called. Our first question today is from Justine Hunter at the Globe and Mail. Please go ahead.
Thanks, and I almost hesitate to ask another question about vaccines, but the Pharmacy Association lobbied hard to get their members involved in this distribution, and I'm wondering, Mr. Dix, did the province negotiate any kind of commitment that they would not offer preferential treatment to their own customers for this very in-demand vaccine?
So let me just start by saying they've been lobbying, yes, but we've also had a very strong partnership with pharmacists since 2009 during the influenza pandemic in 2009 when pharmacists in BC became important partners in immunization. So this has been a negotiation, discussions that we've been having ongoing since we started to have vaccines available. So they have always been part of our program.
I don't think this is an issue of anybody lobbying. In the midst of this pandemic, more than 1.1 million doses of influenza vaccine were delivered by BC pharmacists. In the context of a pandemic, it was an extraordinary success, and roughly 450,000 more, I believe, than had been done last year. So we're working pretty closely with BC pharmacists. The Pharmacy Association has been partnered with us and working with us as we prepare for the many phases of this immunization campaign. I think I've said already, I think Dr. Henry said already, that especially for second doses, we see pharmacists playing an even more central role than they play now. And I think it's impressive that as we made changes required by safety signals with the safety and health of people in our province. We made changes to our program this week. Pharmacists stepped up, and the BC Pharmacy Association stepped up and did this work. And what we have is a process of between 55 and 64 that people were able to book appointments. We know, Justine, that there are hundreds of thousands of people in this category.
那么现在呢，又55岁到64岁，我们看到了又可以去。
Why did we do that? Because we wanted to make sure that every drop of vaccine goes to people in BC before any expiry date. That's why we proceeded in the way we did. But that is the basis now as we expand out the number of pharmacies, and I think next week the number of communities involved. We are going to be able to have more and more success at delivering that. It's not what was planned. As Dr. Henry has said, we've made some changes this week because circumstances changed, because what we could do changed. We adapted, and the BC Pharmacy Association and pharmacists were part of that, and I think it's been very effective so far. So really, the idea is to deliver between people 55 and 64 as we continue to go down and down and down in ages in our main age-based campaign, and this will assist that.
所以接下来的阶段是55岁到64岁了啊。那么我昨天看到是说可以接受73岁以上的，看来现在是越来越加速了。就是下星期他们都着手55到64岁的人的施打的注册啊、预约了等等。
These days, about 18,000 doses of AstraZeneca.
因为这个阿斯利康呢，可以是55岁以下的人不能打，但是这些人55岁到64岁之间是可以打的。所以呢，他就是说这些用阿斯利康呢，现在还有。
I do. The question though is about an issue of preferential treatment, and we've spoken to two individuals who say they were denied a vaccine because they were not regular customers of the pharmacy they were trying to get the shot at. So my question is that acceptable, or do you think that it needs to be explicit that pharmacies are not going to favor their own customers with this vaccine?
You talk to the pharmacies, the issue here is supply. The issue is that we have hundreds of thousands of people eligible in these categories, and right now we had 18,000. As I told you, we were about to receive a very significant, we have received and will be distributing out over the coming number of days, over the weekend. Probably it'll be starting next week, further 188,500 doses, much of which will go into this program. So that's the issue. The issue is supply, as it always is.
所以他也说了，问题永远是在这个供应链的问题。只要供应跟上，我们这个施打就会马上进行。
This isn't a criticism of the government of Canada. We don't have domestic capacity. really the countries that are well ahead of us in the percentage of immunization have the domestic capacity.
因为联邦是负责采购疫苗，全球采购疫苗，他们呢一定要在计划走在我们各个省的前面。那这个是因为是他们提供更多的疫苗。
Then you have vaccine available. There are some people who aren't going to be on that, but we're working closely with the Pharmacy Association
所以我们也是紧密的与 BC 医药技师协会这个紧密的联系我也为他们感到自豪那么所以每个人都
everyone is going to get access to their first
dose 都是积极的参与进来每一个药剂师等等他们都会参与进来给大家施打疫苗。
Or not vaccinated, it's critical right now to follow public health rules.
不管你打过疫苗还是没有打过疫苗，对我们来讲，紧急关头还是你要严格遵守我们的卫生禁令、卫生规则。
In the town of Prince Rupert, in our campaign, in our effort there in the last week, our all-of-community effort in Prince Rupert. In the last number of days, the last 4 days leading into today, I believe 67 people. Tested positive for COVID-19, partly because they would have had the transmission prior to their immunization, but also because, as Dr. Henry has explained,
那么现在目前为止有打过疫苗的里边有发觉67个人还是有阳性，那就是因为他们在打之前就有感染上，或者是打完之后身体疫苗抗体没有出来的时候也是感染了。所以不管你打过针还没打过针，请你们千万一定要一视同仁的、一贯的遵从我们的卫生规则。今天这个数据有意思啦，67个，这个是我是第一次听到。
Next question is from Richard Zussman, Global News. Please go ahead.
Dr. Henry, we haven't seen the variant numbers in a few days. I'm going to assume the variants continue to.
这个记者问的是变异体的数字，变异病毒数字这2天没有给我们公布。
Variant spread. I'm sure you've heard from other experts who say that we should be adjusting parts of our plan to note variant spread. I'm just curious why we're not, and is there anything specifically that can be done around the Easter long weekend when people may be more likely to gather indoors for supper or for a holiday gathering?
Yeah, so we did report on the variants, and it'll be in our statement today. But I can tell you, over the last 2 days,
那么过去2天里边，我可以告诉你这个数据，因为今天的 statement 没有因为上次说的那个基因测序有点小问题所以数据有点滞后。
So we had 90 new cases identified as variants.
那么有90个是新的这个过去2天里边新增了90个。
80 of them were B117.
81个是英国变异体。
B1351, which
这个117就是英国变异体还有一个南非的，还有 P1 就是巴西病毒这个我们是紧密观测，因为巴西病毒这个是我们最关心的，这个是延安卫生局。同时呢，我们也已经这个调整了。
Now we have over 90% of all of our positive cases are screened.
OK， 那么调整了这个监测程序。现在呢，只要90%的检测阳性样本都去做基因测序。本来是10%，现在已经90%了，这个很厉害了。
They spread more easily.
因为这些变异体很容易传播。
In some cases, they lead to more severe illness.
那么有一些呢会引起重症。
Have a reduced response to some of the vaccines. Although new data that's come out this week has shown that, particularly the B117. All of the vaccines that we have in Canada work well.
那么他说，有关英国变异体 B117呢，我们在加拿大的这些疫苗都很有效。
That is a little bit more concerning, but it still has good response.
那么南非病毒现在也是有效的。
More transmissible, but the very same things that we do to prevent the old viruses.
所以这个变异体和其他的新冠病毒是一样的性质，所以我们一定要防护。
Is that margin of error is that much less that it can spread more easily. So we're seeing more
但是大家一
contacts
定
who
要记住
are
这些
who
变
become
异体
positive as
特别
well
容易
with some
传
of these
播
variant cases. And yes, we're doing additional testing. You saw
所以
that
我们
in
已
some
经
of the
大家都
exposure
可以
events
看
we
到
had in schools,
BCDC 的
particularly
这
in
些我们
Surrey,
学校
around
啊
the
处理
B117.
啊
And thankfully what we
这
found
个英
was
国
that
变异
there was
体的
not
监测特别
transmission
我们
in the
加强
schools
了大家
for
可以
the
看
most
到了
part.
我
So
们
that's good news.
测试的人
We
越
are
来越
doing
多
additional
所以
testing,
这
but
个
every
好消息
single
是没有
case
看
in
到更多
BC
的
is
这
followed
个
up, whether it's a variant or not. And we
更多的
often
阳
don't
性的案例
know
发觉
until a couple of days later. So we are watching
所
carefully
以我
around
们也是紧密
hospitalization
的
rates
看测
and people
主要
who
是
end up
观
in
测这个
ICU.
住院人口
I can
以
tell you
及
that
重症监护人数
especially we've been investigating. There was
那
a
么我们
cluster,
也
a
调
large
查这
cluster
个
in
零
Vancouver
星
coastal
的
that
这
is
个
now
沿岸的
contained,
爆发的零星
and
的
there's
案例
been an increase in these P1
因为这个
in
他们是爆
Vancouver
发的
coastal
巴西
and
病毒
Whistler, and some of that has spread to other
这个
parts of
从
the
惠斯勒传
province
过
in
来
very small numbers.
那
But
么
we are
在
watching
省
very
的其他
carefully
部分
and following
其他
up
地
people
方也
very
有小
carefully.
部分的
But there's
爆
no
发
focal
P1 的病毒
super spreading event that's related to these. What we're finding is there's small chains of transmission in
你发觉
multiple
吗？
areas that
当
aren't
我来
linked.
说巴
So
西
it
病
is
毒
community
南非
spread,
病毒
and
英国
that's
病毒
why
的
it's
时候
so
大家都
important
坦
that
然
we
接受
take the actions
但如
that
果
we
我
did
说武汉
in
病
and
毒
around
大家就
Whistler,
觉得很冒犯
to
这
try
个
and
其实也
reduce
是
those
双标
opportunities
所
for
以如
spread.
果说
And we are
B17
supporting people to
B17
self-isolate
B19
if they're in
P1
group
那
accommodations,
就
for
这样就
example,
因为你
to
既然
isolate
武汉
safely.
病
We
毒
have
说
places
成
to support
COVID-19
people to do
那么
that.
也可以
So
英国
the
病毒
same
就说成
measures that we
B17
take
所以很多的时候
that
媒体里边
for
说
COVID all
B17 大家不一
along
定知道
work
但
for
说
the
英国病疫
variants.
体
We just
大家
have to
大家
do
就
them
知道
more
南非病毒
carefully,
大
and
家
that's
就知
more
道了
important than
所以
ever this
我
weekend.
个人不认为这个武汉
Yeah,
病
the active
毒
case
是
numbers are actually
地域
down a
歧
little
视
bit. This will all
我
be
不
in the
认为这个是
statement,
地域歧视
but
大家可
they're
以
down
砸
to
砖
192.
这个是我个人的看
And we
法
have 35 people who are currently in hospital
可以
with
过
one of
去
the
还有什么
variants.
这个他说这个35个人在
I've
住院
mentioned this
这个
before,
变异
but
体里
we
边
do
有35
follow
个人
the
变异体住院
demographics, and what we're seeing is it is mostly a younger age group,
主要是
between
年纪轻的人
19
19
and
岁到50
50,
岁之间的
overall.
年龄组
And for the P1 that we're seeing, not surprisingly, given where we're seeing it, mostly 19 to 39
那么
year
巴
age
西
group.
病毒呢是19到39
Richard,
岁
do you have a follow-up?
之间的变一点都不吃惊
I
都是这些人
do.
都和世界上
I heard a lot
其他的数据
from
都
a
差不
group
多
of people across the province from age 65 to 71 who quickly saw people slightly older for them get chances to reserve vaccinations. They have now seen some younger than them in Metro Vancouver not be able to receive AstraZeneca. There's a lot of frustration from this group that wants access to the vaccine. I know there was an update today for one of those years, but can you give these people some hope of when they will be able to register for their vaccine and explain to them why seemingly it is taking much longer to get to them as it was.
那么他也是说到了在我在大温地区看到有些人 他没有
there's two different things that are going
这
on
个
there.
注册
One
的
is
问
we've
题有
moved
些人
down
觉得
the
沮
age
丧
groups.
他
It
说
has
这个
been
是两
very
回事
closely tied to amount of vaccine that we've received.
因为
And Minister Dix mentioned we were expecting a large shipment of Moderna
他说
last
卫
week,
生厅
which
长
was
我们
delayed,
上个礼
and
拜
still
应该
a
到的
large
很
part
多
of it
莫德纳
hasn't
那
arrived.
下礼
In
还没到
addition,
但是会
we
很
have
到
the clinically extremely vulnerable group that
那
has
么
now
另外一
started
个
to be
就
in,
是
and
易
that's
受
another
感染易受攻击的这些人呢
150,000
这个
people.
可
And
能
as
是
we
有
move down
几
every
千
single year,
上万
the
人
number of people or the cohort gets larger. So it was, and some of the health authorities, particularly in the Lower Mainland, when they had vaccine last weekend, had gone down to 73. But then, as
他说
more
低陆平
vaccine
原
didn't
现
come
在已
in
经
at
有些
exactly the
年龄已
right
经到
time, it was
73
kind of
岁
stuck
让他们可以
at
打
that
了
age
但
for
有
a
些
couple of
卫
days.
生
So
局还没有
we are
差个
titrating
几
it
天
to vaccine that we receive,
因
and
为
we've
我们
gone down
在这
today. We
个
expect
就是因为受到
in the
到
next
货的
few
情况
days, as more vaccine comes in next
那
week,
么接下
assuming
来
it
呢
all arrives when
下个礼
expected,
拜会有
that
很
we'll
多
be
货
able to
很到
continue
疫
to
苗
move
会到
down to the
所以我们会很快的
hopefully very
把这个
soon to
打疫苗的年龄往下走
65 and up.
70岁啊
So
65岁啊
the rationale or why we had a small amount of the AstraZeneca, it was after we had seen the
因为为什么我们现在还有一些多余的阿斯利康疫苗，就是因为有一个安全的信号来了之后，我们不是暂停了那些施打 打嘛，所以现在有多余的。那么明天就要过期了，所以呢，我们要让这个那些多出来的人，就是刚才解释过了在大温地区的这个55岁到59岁的这个是很理性的去用合理使用这个阿斯利康这个是有18000人让他们打。
To slight those in the 65 to 72 age group, it was because we knew there was more vaccine coming into that core of our program that would be available within the coming days and weeks. So it's trying to find that balance of getting both at the same time as much as we could. And really what the challenge has been that I'm working on, that we're working on is we were committed to using the more flexible fridge-stable vaccines for our worker program, and we'll need to recalibrate how we're going to do that. So I'm asking for patience from all of our first responders and the other worker groups that we had identified. We have been using vaccine, as you know, to try and address workplace outbreaks, and we don't have that supply right now because of the stop on using AstraZeneca with the younger age group for now. So we are hopeful, and we'll be following. I know much of my weekend we'll be looking at the data that's coming out of Europe and following up with our colleagues in Health Canada, and hopefully we can get that back on track as soon as possible.
而不能解决这个63岁到65岁到72岁这部分人，因为这部分人本来就应该打，但是呢疫苗没到，所以等疫苗到了还是要给他们打的。而那个阿斯利康呢，明天就要过期了，所以让他们去打。
What efforts are being made here in BC to ensure those who are supposed to be quarantining for at least 14 days are actually isolating themselves and others in their homes?
So that is there's a bit of a nuance to that, Marcella. So it is if you are in a close contact with somebody who is positive with one of the variants, because it's more transmissible, and we're seeing transmission in households. So if you are still in that household and people can't effectively isolate within that household, then you are no longer infectious after 10 days. And the quarantine period for your close contacts starts after that infectious period. So that's where you get the 24 days. So they are supporting some people to leave their household for the 10 days of their infectious period and be in hotels or other places. And we have done that in some places as well. Whistler's a classic example where we had a lot of transmission in accommodation, in group accommodations that were related to workplaces. We were able to go in and do some immunization there as well, but it's very challenging to find places for people to safely isolate. And for some families, that's not acceptable to them, so they would prefer to be together at home for that whole period of time. So it's a combination. We've been doing that in many areas of the province. The clusters in the community in Big White and some parts of the downtown east side where we're able to effectively separate people. Right now we do case management and contact tracing and do work with families and have also do asymptomatic testing of people, particularly focused on people with these more transmissible variants. So it is a strategy that is it's more of a localized decision with the local contact tracing team on an individual basis.
Marcella, do you have a follow-up?
I do. I forgot to ask you how many people are isolating now, but if you could add that in. And the other question I have was that you mentioned during your earlier comments about people now having to wait. Could you specify, is that first responders, teachers, like are they essential service workers that may now have to wait a little bit longer to get a specific clinic done for them?
Yeah, so all of the I didn't go through all the details today. I'm trying to, do these questions things on Thursdays so that we have a little bit more time to get into some depth. But it will be in the statement. We have about currently active There's a comma in the wrong spot. I almost had a fit here. It said 75,000. I think it's 7,571. So that is up considerably right now. But in terms of the active cases that are variants, it's down to 192. And there's now about 11,600 people who are self-isolating right now. And yes, our intent was always the main part of our program was the age-based program with Pfizer and Moderna. And we have this parallel stream that we started with first responders, with workplaces, that was dependent on our fridge-stable vaccine that we were doing in communities with pharmacies and pharmacists. Assisting at workplaces and work sites. So that is on pause now because most of the workers are younger than 55. So we are recalibrating. We're going to be following, as I mentioned, what's happening with around the world with the data around this vaccine. And I am confident that we will be able to get back to that program soon. But we need to make sure that we're all comfortable with the safety
全世界都在研究这个事情加拿大也不急 BC 省也不是最先的所以因为这个安全是最重要的所以这样大家呢我们也认为在等强生疫苗来那么这样的话呢就打一针就够了那么 Novavax 呢好像对变异体病毒更有效
until we get more information about how we can best do that and move it forward again.
所以这个记者问的有点问题因为上次就说过阿斯利康是给这 first responder 包括救护队员这个基础工作人员以及这个教师但是现在55岁以下不是不能打了吗所以要让他们等一等了但是他说我有信心马上就会恢复的
CTV found some at the ferry terminal today who knew the rules, who heard the message, and traveled anyway. I'm just wondering why you think maybe the message isn't getting through, and what would you say to them?
I'm going to say something first too, which I've said all along, that we know that the people who have had the biggest challenges to overcome over this past year and over a year now, and who've had in many ways the least influence on events have been young people, and whether it's people who are graduating from high school, and I know there are youth in my life who've been through this, and not having those important celebrations of passage, whether it's young people whose job prospects have been damaged because this virus transmits and has affected the food and beverage sector and the hospitality and the tourism sector. So I have a lot of empathy for young people, and I know it's a very challenging year, and we as a community and society have an obligation to make it up to young people.
精力充沛到处充满了活跃，但是呢，这个是最大的感染群体。我也是同情他们，但是今年和往年不一样这个是请大家能够忍一忍。
Which is that it's not too late to join the fight. That this is going to be a very difficult month.
所以这个月还是很困难的3月份但是大家一定要遵守我们的行为规范，特别是年纪轻的人这个是一定要遵守我们的卫生命令。
Increasing transmission amongst young people, that's variants of concern. In particular, the median age of people with the P1 variant, the variant associated with Brazil or discovered in Brazil. The median age is 28, which means that half of the people essentially are who get the Brazilian variant are under 28. I think we have to put that in context. Those numbers, that risk, the risk to parents and grandparents and loved ones, and the risk to ourselves. If we look around the world in jurisdictions where the variants have grown, and where we're in the same circumstances as we are, which is most of the other provinces in Canada of our size, in many countries, for example, in Europe, you're seeing increasing number of cases right now linked to the variants. Increasing number in those jurisdictions of young people.
所以他说欧洲也是这个现象，这些新的变异体或者是这个爆发的数量都是年纪轻的人在爆发。所以为你自己、为你心爱的人为你长者请大家一定要遵守我们的卫生命令卫生，特别是现在 我们每一个人都要参与进来。那么，就算是疫苗已经快速在推广了，但是一定要再说一遍我们现在才6个人里边1个才打了疫苗，还远远没有到全体疫苗的群体免疫的程度。
For all of us, no matter what your age, 25, 35, 45, 65, 85. To at this final moment in the COVID-19 pandemic, of this phase, of this immunization phase of the COVID-19 pandemic, to get sick, and we've got to do everything we can to avoid that.
居高临下那种以上至下的那种命令啊，或者是这种长者对这年轻人的这种趾高气扬或者命令式的不一样的。他只能是劝你们这个是西方文化也是这样大家家长对孩子也是这么说话这个是东西方的区别。
All of people with deep information and lots of support and medical advice and all the best doctors have got sick. We don't blame people for getting sick, but we do have to come together now. Us and the vaccines against COVID-19. That's what I would say to people. It's time for us to come together and listen to public health guidance and follow those orders, especially for this period that we're in now, this period between now, really in the end of June, as we're providing everyone their first dose of vaccine.
Binder, do you have a follow-up?
I wanted to ask about the variants. There's a relatively low number, I guess, a lower number in the last couple of days. And just wondering, what is the takeaway? Is that good news? Is it a blip? And also, with the positivity rate in BC growing and being quite high in some parts, is it time to expand testing?
I'm not sure where we would expand testing, and we do have quite a lot of testing being done. We have asymptomatic testing being done where it's appropriate. Part of the reason that we're seeing higher percent positives in places like the North, for example, is because we are testing the people who are most at risk, and so that's appropriate. The fact that we've seen a lower number of variants in the last couple of days, even though our surveillance has ramped up, it's too soon to tell. We've certainly seen small numbers in different parts of the province, and we're focusing on those, trying not to let them take off. But I think there is an inevitability. There's a replacement, at least, of variants. Particularly the B117, and it is replacing the virus that we used to see because it has an ecological I'm trying to think of the name of it and what I'm trying to say, but it's on the end of my tip of my brain, but it's because it's got a survival edge. So we see this all the time where it's able to survival of the fittest, it's able to take over. So we are, of course, paying attention to it and monitoring very carefully, but we'll see. Most important is to reduce transmission, and we reduce transmission, we reduce all of the virus that's circulating in our community.
We have time for one more question. For everyone listening, Dr. Henry and Minister Dix will release a statement this afternoon with the latest information on cases, hospitalizations, and outbreaks,
今天又换了一个，原来这个地方是一个印度口音的女士，今天不是。
Our last question today is from Tanya Fletcher at CBC.
I was just going to say it's competitive advantage. That's what I was trying to think of. 7 has a competitive advantage and has been moving out the other viruses that we've been seeing. So sorry about that. Go ahead.
Oh, hello. I just wanted to ask about variants as well. And I know that you've said in the past that more young people are being hospitalized. We know that. And you also mentioned today that
他所住院的人，年纪轻的人也多了，主要是感染的变异体。
But Alberta's provincial health officer just said they're seeing more young people hospitalized due to variants. So is there updated data around the correlation between variants and young people needing critical care in BC? Are there any new commonalities emerging here about which demographics they're hitting and why and which settings they're spreading in? I mean, you mentioned community spread, but do you have
包括这些哪里的这个环境下获得的或者
about so what we're not seeing an increase proportion of younger people who are hospitalized. So it's about the same as what we're seeing for all of the other.
他说，年纪轻的人的住院的比例跟人体的住率差不多5%啊。
Of people who have a variant case who are hospitalized, but because we are seeing an increase cases in younger people,
主要是年纪轻的人的阳性人
hospital have gone up.
那么所以他们的这个住院的人也多了。
Younger people are thankfully more likely to survive.
那么同时呢，这些年纪轻的人年轻力壮，他们呢容易活下来。
Are needing ICU care. So the percentage of younger people who are in ICU has gone up. It was about 19% of all ages. So still 5% of people are hospitalized.
5%的人还是5%这些年纪轻的人住院，但是呢，在重症监护，他们有19%的人做重症监护重症监护都是变异体。
Relatively small. We're in the. I think that we're up to about 60 people now. So. It does make a difference. We're
所以在重症监护不成比例，住院的人数还是成比例的。
Transmission again is the same settings that we're seeing.
那么传播的途径还是一样的，环境下都一样的，他们没有变化，没有什么特别的地方容易特别传播。主要是社交场所。很多年轻轻的人主要是在这个餐饮行业或者是这个宾馆行业他们人群拥挤的地方我们已经看到了这个病毒变异体都容易在室内的传播。
People together, not wearing masks.
他们不戴口罩，又在室内那么大家说说笑笑那么密闭空气，通风又差。
Those are situations
所以这些是最风险大的。为什么我们一定要这个不能这么去做一定要让大家保持社交距离，能够室外就是室外去这个才是安全的大家能够安全的互动。
Make sure that we can do that safely.
所以你们一定要考虑到你们家里边的长者，社区里边的长者。
Tanya, do you have a follow-up?
Yes, and if we could get an answer in French from Minister Dix as well, that would be appreciated. Thank you. We've seen some staggering case numbers in the days since the circuit breaker was announced on Monday. Can you tell us what British Columbians should be expecting in the coming weeks, as in how will we know if the circuit breaker is working and when? Give us the measuring sticks we should hope for.
So one thing that is still the same is that the incubation period is about 14 days, and the most transmission that we see after exposure is about day 5 to day 7. So we are now in the place where there is a large number of people who have been exposed. We talked about it's about over 11,000 people.
现在有11000多个人在隔离当中，因为他们都被暴露过了。这个也是我们的跟踪接触工作同事们在积极在做的这些事情。
Contacts where it can be transmitted has been going up, and that is one of the reasons why we took the actions that we did. We were, as you know, sort of keeping our own with the actual infectious contacts staying fairly low, and that has increased in the past 10 days, and that's what we've seen the spike. So we are not out of the woods by any means. There are 11,000 people who've been exposed. A proportion of those people each day for the next 2 weeks are going to develop illness.
有可能在这个14天里边，有些人就会发展成有症状。
generation of cases. So we are likely to be in for a rough ride for the next few days. And those people who have had contact with somebody who's been ill,
所以我们也呼吁
you
大
need to
家，
stay
如
away from
果
others. You
你
need to
如
stay
果
safe.
有怀疑自己跟这些有风险的人或者是阳性的人接触过，那么请自我隔离，特别是接下来的几天里边是很关键的。
presentation was last Thursday on the variants information, so it's on the BC CDC website and associated with the presentation on the day. But we can also provide it for people again.
所以有关变异体的信息呢， 呢，在我们 CDC website 都会有网站都有。那么他又可以说法语了。那么我再给大家总结一下，在过去24小时里边新增了是832例，那么全省呢现在累计总数已经超过10万例了，其中沿岸卫生局是310例，菲萨卫生局是388例。这个是一个很大的现象。同时呢，这个岛上卫生局是53例，内陆卫生局是42例，北部卫生局是39例。住院是296个人住院下降了，本来300多个。重症监护是76个人，过去24小时里边新增了3例死亡。那么现在死于新冠相关的总数呢到了1463个。我刚才记得他说了打第一针的已经超过80万了那么总数呢基本上是6个人里边有1个人已经打过了。但是就算打过了，卫生厅长也说了，因为博尼医生说打完了之后要3周以后有效率才达到79%和80%以上，所以就算你打过了，也请你遵守卫生禁令、卫生条例那么刚才这卫生厅长也说了，目前为止打过针的 Bc 省阳性也有30几例了这个呢有可能就是他打之前就有感染过，或者呢他打完了之后就是认为自己认为有护体了到处乱活动，这样的话呢就会感染了。那么他也说了，大家这个长周末愉快。好吧，长周末愉快。那么谢谢大家，我也祝大家这个明天这个 Good Friday 耶稣受难日以及下周一的这个复活节请也祝大家长周末愉快待在家里就能够待在家里就待在家里。好了，各位观众感谢您的收看，您对我的支持也是我工作最大的